Pre-retinal hemorrhages could be located in either a subhyaloid or a sub ILM plane. Common causes include Valsalva retinopathy, retinal microaneurysms, and proliferative diabetic retinopathy. In this video, we would take you through a variety of intraoperative situations in relation to managing these hemorrhages. This is a case of non-resolving pre-retinal hemorrhage with dehemoglobinized blood. Core vitrectomy was followed by IVT-assisted PVD induction. Inability to aspirate the hemorrhage with the cutter suggested the sub-ILM nature of the bleed. Brilliant blue dye was used to stain the internal limiting membrane. The peeling was carried out under high magnification. This gave free access to the trapped hemorrhage. The blood was then gradually aspirated with the cutter. In this case, PVD induction was carried out after staining with triamcinolone. However, hyaloid removal did not expose the trapped hemorrhage. At this stage, brilliant blue dye was used to stain the ILM and then remove it tangentially using a forceps. The exposed blood was then gradually aspirated. This is yet another case where removal of the hyaloid did not expose the pre-retinal blood. While aspirating the surface with the cutter, there was a small breach in the ILM through which some blood oozed out. A forceps was used to totally peel the ILM all around the area of hemorrhage. Once exposed, the hemorrhage was gradually aspirated. Dehemoglobinized component of the blood was also revealed. The circumferential rim of the ILM was further removed to expose the residual blood. This case seems to be a classic subhyaloid hemorrhage. The blood was aspirated using a cutter. However, we realized that some part of the hemorrhage was sub-ILM. At this stage, we removed the ILM using a forceps to further expose the residual hemorrhage. In this case, the non-resolving pre-retinal blood was totally dehemoglobinized. Hyaloid removal was done, which exposed the underlying hemorrhage. Gradual aspiration of the same was done with the cutter. These cases demonstrate that the plane of a pre-retinal hemorrhage is not always possible to determine pre-operatively. During surgery, accurate visualization using high magnification allows perfect delineation of the planes to evacuate these hemorrhages.